That's what we do at Rexall. We care for Canadians' health one person at a time. The Rexall brand goes back as far as 1904, and we haven't stopped innovating since then.
Welcome to the Rexall Health Solutions Commitment to Care webinar. Here at Rexall Health Solutions, we're incredibly proud of the privilege you give us to serve your home and your residents. Everything we do is rooted in a commitment to care and ensuring that we exceed the health outcomes and level of expectation of service that you have asked of us. What sets Rexall apart as a provider of pharmacy services is really our commitment to care. We are dedicated to all aspects of caregiving, whether it's through our Rexall Care Network, through the various support we provide to associations that support caregivers or individual caregiving initiatives. And as a team, we are very focused upon the fact that at the end of every prescription, there is a loved one. And we are always focused on ensuring that the level of care and the level of service represents how we would care for one of our loved ones.
Care to me means, everything that I do in terms of my actions comes from integrity. It's that always striving for excellence. It's, ensuring that our customers succeed, because when they succeed, we succeed. It's that respect that we show to one another as employees, but also in those partnerships and relationships that we do develop with our clients and our customers and our patients.
It's how you should act as a human being. It's how you should act as a partner, a true partner who cares about others. Everything is rooted in integrity. So care at Rexall and Rexall Health Solutions is really at the heart of everything we do. It's about caring. It's about ensuring that it's not just a commodity relationship of here's your vial of pills or your strip package pills. And we go far, far, far beyond that. We have nurse advisors that go in to support and educate the staff in the homes to provide better care. We provide innovative tools like Abby, which helps improve the life of memory care residents. There never should be a concern from anyone who has given us the responsibility and the privilege to serve them that they're not going to be cared for.
There's a lot of emphasis around ensuring that customer experience and that we're providing that care every single day and with each interaction that we have with our patients. And whether that's in our retail stores and all the great work that's being done by those frontline pharmacists to, our pharmacists that are going into our homes and our long-term care and retirement and group home setting is really that providing that high quality pharmaceutical care to our patients and ensuring that their health and well-being and their wellness needs are being met and exceeded, and that they feel that they really have, someone backing them up and looking out for them as a whole person and not just, based on medications, but how can we really support them holistically in their journey to better health and wellness. We see that health and wellness as part of the launch or our partnership with Tia Health, which is access to virtual care through different physicians and specialists. And then the ability to have your prescriptions delivered direct through your home through our Rexall Direct program. So we have, a number of different business units and, the larger part of Rexall and McKesson, we're really invested in these different programs to really bring that wellness piece to Canadians and really make it easy and accessible for them so that they have all the tools and information in order to make really sound healthcare decisions for them, knowing that they have a team behind them to back them up. Rexall was in a really unique position to be able to respond to the pandemic and COVID-19 in that being part of a larger organization like McKesson, we had the bandwidth, the resources, and availability of information flow as well. So through constant communications with public health agencies, provincially and federally, we were really able to pivot and be agile in how we were going to respond effectively to this pandemic. And it became very clear quite early on that our priorities were going to be the safety of our employees and our residents and our patients that we service, and that the business continuity was key. So I think when the pandemic hit and, COVID was, in everyone's lives. I think there was a lot of really a sense of anxiety, of unknowns, uncertainty, not sure what this was going to mean for themselves, for their loved ones, their families, how this was going to maybe impact them, whether that was financially, from a health perspective. So, I think when we looked at how can we reassure Canadians, and, I think that was a really key part. And pharmacies and pharmacists have always played that really trusted role in the eyes of Canadians and in our communities. And so we really felt that deep connection to ensure that we provide that continuity of care, that, patients had still access to their medications, that they felt safe and comfortable still coming into our stores.
We are a nimble provider. We are able to respond very quickly to changing needs. We're able to respond to changing demands. And as such, I think that, that at our forefront, and then coupled with that absolute obsession with caring for others, allowed us to, exceed, expectations in many scenarios.
A couple of examples that Rexall implemented as a result of COVID for our stores was enhanced cleaning and sanitization measures. So ensuring that surfaces were being cleaned every 30 minutes, making sure that our teams not only had access to the appropriate personal protective equipment, but also knew how to don those and doff those appropriately. So how to safely put them on and remove them at the end of each of their shift or every few hours. The other pieces is we have signage everywhere too. We made sure that there was screening upon entry into our stores. Anyone coming into their shift also ensured that, they had an employee self-screen as well for COVID and symptoms. We did a lot of education. We provided a lot of resources too.
Our mission here at Rexall Health Solutions is to ensure that we provide the level of care equal to what we would provide to one of our loved ones. And never forget that every time we have an interaction with a home, every time we provide prescriptions to a resident, that's someone's loved one. And it's very, very important to us that they receive the care that our loved ones would. We are absolutely committed to ensuring a seamless onboarding experience. And there's many aspects of that can be quite complicated, can be quite challenging. So what our customer care team is focused entirely upon is that we want to simplify that experience for the home so that we worry about the things they don't need to worry about, so that they can focus on providing care to their residents. We ensure that we take away the stress, that they don't have to worry about interruption in supply chain provision. There have been instances where, we take over responsibility for provision of pharmacy services to a home who lost their provider, overnight, let's say, and we drop everything to be there for them to take that stress away. So our customer care team, whether it's the managers in the field, whether it's the team in our office at our RSC, everyone is aligned and focused on that seamless commitment and continuity of care. But also, we're not a large team, so we're very nimble. So there's this seamless conversation, if you will, that goes on amongst our RHS team, which then leads to a seamless experience on the onboard. But during COVID-19, there's been very little movement, if you will, within our sector. So even homes that have entered into new partnerships with providers, not just with Rexall Health Solutions, but they're remaining with those partners because during lockdowns, during quarantines, they're unable to allow non-patient facing, if you will, or non-resident impacting staff and any third-party staff to come into the facility. And so as a result, the steps involved in a true onboarding and offboarding, if you're changing providers, you can't do if you're not physically in the building. And so there's been very, very little movement. What we've done, and I'll give you an example, is we have a new home partnership in Northern Ontario. And what our team did is they reached out, through COVID, they've worked with the home to have access to the EMR. They're already, ready to hit the ground running, if you will, once the lockdown or the quarantine lifts, so that, there isn't a pause in data entry. Data entry is a significant workload for us as we onboard a home. And so what that team did under Linda's leadership is they got ahead of the curve and did all the data entry work, if you will. And there's live data that we see, live patient metrics, patient data, prescription data, that we're already ready to work with it, so that the minute we can get in to provide the onboard functions that need to physically happen, we're ready to go. And so, that's just one example of the commitment the team has to ensure that we don't have interrupted care.
So the Unregulated Care Provider program is a unique program offered through Rexall Health Solutions. And it's really a comprehensive education and training program for those who are coming into the retirement home, assisted living environments, and may not have, the full knowledge of medications or the safe administration practices. And so we've developed this program that is not only in-class training based, but also this new, unique sort of interactive online platform that really goes through safe medication administration practices. It's based on best practice guidelines. It's based on regulations, and really the intention and the aim of the program is to enhance that knowledge, to provide that unregulated care provider with the confidence, the skill set, and the know-how on how to safely administer medications to residents in assisted living and retirement home communities. The unregulated care provider works very closely with the registered staff within a retirement home. And the main responsibilities are really around maintaining those daily activities of daily living for the residents. So helping them with whether it's feeding or cleaning or changing. And they're really an important role within that setting as they develop these deep relationships with the residents. So they've almost become like family to them. So traditionally, unregulated care provider training was always in a more classroom type setting. And we certainly still use that and leverage that. There's still a lot of value in having face-to-face training. Where we wanted to complement was with our online training module. A lot of time what we were hearing from our clients and the unregulated providers too is that they wanted to have easy access, convenient access to training anytime, anywhere, any place. And so with our Unregulated Care Provider program, they have the availability now to go online, go through these different modules. We've worked really closely to design this program with our learning and development to ensure that we had those adult learning principles embedded into it so that it was fun and interactive and a great way for that group of individuals to learn. So it brought in the different key components to ensure that safe medication administration, but also did in an interactive way through videos, through PDF resources. We had different icons and tiles that they can flip to give those sound bites of information. So we really tried to make it interactive, also conscientious of the time that everyone has to do it. So it can be done in easy, convenient modules at whether it's the comforts of their own home or whether it's in their assisted living or retirement home community. So it's really tried to encompass, a wide range of different formats to ensure that high quality, consistent training for the UCPs. So I think from the home's perspective, it gives them that confidence that they have access to that high quality content, but also just the convenience and ease of which they can access it. And, I think really overall too, we really want to be able to train up more unregulated care providers so that they're equipped with that confidence and that training to then go into the floors and start working, right away and supporting our residents and providing that resident care at the home. And I think the last point too is just the satisfaction of the training. We're hearing, from some of our UCPs that this program has really helped them in understanding safe medication practices, and they know now more a little bit about medication classes where maybe they didn't, or how to recognize a side effect in a resident. So I think it's the satisfaction too that we're hearing from the unregulated care providers that have gone through that training that homes can also look to as, a measure of success with this program.
Hi, I'm Marian Heemskirk, and I'm the Director of Community Life at Elam Village in Surrey, British Columbia.
My name is Janice Gerbrand. I am the Director of Corporate Services for Rehoboth Christian Ministries.
Hi, I'm Hazelyn Kinney. I am a Nurse Advisor for Rexall Health Solutions.
So my relationship with Rexall Health Solutions is we're one of their partners, and they are one of our partners. We work together. They provide medication for our residents who live in assisted living, full care, independent living. They also help support the doctor's office, which is on site as well. Rexall staff members that are working there also support our staff that work at Elam Village. So if any of the residents have challenges, questions, it could be staff members having challenges or questions, either about medication, about dosages, about errors, all those types of things. That is where Rexall has a great connection with our staff.
It was always a barrier for us to be giving the fantastic service we want to give. And so when Rexall came to us and enabled us to be able to deliver that from one sole source, it just changed everything for us.
What I think is very unique about Rexall Health Solution is the role that I am currently in, and it's the nurse advisor role. And it's because it's such a collaborative role with the homes that I support. It looks at assessing their needs and looking at how I can support them when it comes to medication administration. I also hear from my colleagues as to what is working well, what supports that the home needs, and then we come up with a collaborative plan. And we, help support the staff to meet their goals.
Elam is very fortunate to have Rexall Pharmacy on site. So throughout COVID-19, there hasn't been any interruption in delivery or service for our medication.
So we were able to ensure safe, uninterrupted delivery of medications because we use Rexall, and Rexall was able to ensure the delivery of the medications to our sites. And so there was no change for us there because they were already delivering all the medications to our site. So there was no break and no interruption in service. But we also did work with Rexall to have more medications available on hand in case there was an interruption, and so that we did have the medications continue. We also combined and ensured that the medications that were being delivered in the day program previously were combined into the residential medications so that there was no interruption and nobody missed their daytime medications. And we also developed a manner in which the med training was done as a means to an end. Until the UCP program was available to us, we were able to deliver our medications through a virtual, our training through a virtual method.
We also have Rexall Pharmacy, and they were another partner who definitely helped us during the pandemic to make sure we had all the resources we needed, whether it was assistance with medication, whether it was medication deliveries, whether it was supporting our residents just in questions that they had or questions that our staff had.
And of course, Rexall, they were able to support us in our training and our clinical hours to make sure that everyone was safe.
The Unregulated Care Provider medication training module is a very collaborative approach. It involves the pharmacist, the nurse advisor, and the leadership at home and the staff members. And what this kind of entails in an overview of, it involves in-class training, virtual education, and a demonstration of a medication path. And so at different points in time is the involvement of the nurse advisor, the pharmacist, and leadership at the home that kind of gives that collaborative approach. What we look at is actually an overview of what, the UCP's role is. It clarifies their role in medication administration. And this actually helps them to identify, okay, I understand what my role is with medication administration. We show numerous amounts of administration guidelines and videos to give that for the visual learner. We have a reference list of common classification of medications. And the great interactive piece to it with the modules is the questions to test your knowledge. And so that it's a fantastic collaborative approach and a very comprehensive training. Rexall Health Solutions, kind of shifted gears during this whole entire pandemic. And I can speak specifically about my role and how I shifted to support the homes during the pandemic. And so I provided various different modalities of learning. So I would pre-record a lot of our educational sessions and chunk it up into very short periods of time. As we know, a lot of staff members don't have that, luxury of time to learn during their shift, or they can actually take the information and learn at their own, time. So anything from insulin administration to pain management, I shifted in changing my, in-person teaching to virtually. I also would conduct, live virtual training and would have a room full of, unregulated care providers and teach them about medication administration. So I adapted a lot of my in-person, teaching to actual virtually.
A specific instance in what Rexall was instrumental in was to develop the UCP training. That is something that we have been looking for a while. And so we were just ecstatic to have that training available to us to ensure that our staff know what's expected and can do all of the delivery of medications, because they're not nurses and they're not educated in that manner. And so this format allows us to do that. They've been very responsive to every request we've made to make our ability to deliver medications safe for all parties.
During the pandemic, Rexall was able to help us in a particular way. And one of the thoughts that come to my mind is a client coming back into assisted living who had returned from hospital. Anyone returning from hospital has to stay into their suite for 14 days, but also their medication often changes when they've come back. So Rexall Pharmacy has assisted us in giving the correct medication to the person who has returned back from hospital.
My role in developing the UCP medication pass training was a very collaborative approach with the pharmacist, myself, learning and development at Rexall, and actually the staff members at the homes. They're the end user, and it was to understand what they, needed when it came to medication administration that helped, foster and develop, the medication training module. And so with also my years of experience, working with best practice guidelines, and, there was a lot of reiterations with the development, with the team in order to actually, present a program, a training module that we're very proud of. The ILAR module is a fantastic module. It actually tailors the education to the individual. It appeals to very different learning styles, whether it be auditory, visual, or in written form.
The Unregulated Care Provider program was a course that was put together from Rexall that gave some training on how to deliver medications safely and to make sure that our employees knew how to deliver all different types of medications. It was a bunch of videos that were put together, and then a test that was put together at the end that you had to pass in order to be considered qualified. So Rehoboth sees the most merit in the Unregulated Care Program. We are able then to deliver it virtually to our employees and be able to ensure that they are able to deliver medications in a safe manner, and they know how to deliver all different types of medications and different delivery methods.
I think the training, what it means to the staff member and to the homes is that it actually provides, that sense of empowerment for the unregulated care provider. It gives them that autonomy, that sense of achievement when they've completed the course. And secondly, it also provides that human resources part of it, especially during a pandemic when there are staff shortages. We have that extra added support with the UCPs giving out medication administration. The multimodal learning strategies, it's very supportive for the unregulated care providers because everybody is different in their learning styles. It appeals to the different learning styles. You have your visual learners, you have your auditory learners. So what we've developed taps into those various areas. And those that are very, hands-on, have to, read and write, that's when the demonstration of, medication pass comes on in. So what I believe that it increases their skills is that it reinforces their knowledge comprehension in the different types of learning strategies out there. Multimodal learning strategies promotes, resident safety. And the reason why I say that is that, initially the staff member actually received that foundation of learning. And so, them understanding the knowledge of medication administration, understanding and what entails in medication administration promotes safety. And at any point throughout their shift or throughout their career, if they were requiring refresher, that modality is there, readily available for them. And so they're able to tap into that when they're unsure of certain procedures or administration techniques. So again, promoting safety for the resident there for administration of medications. And so we also encourage that, it's best that they annually also refresh the medication administration training course so that they're receiving the most updated education. And again, that's promoting, resident safety. Some of the benefits and challenges of providing the medication administration education during COVID was adapting. And what I found challenging was that, instead of providing in-person, education, I was learning to, develop a course online and looking at the different multimodal strategies. So a lot of the challenges was actually developing that course to meet the needs of the homes. The challenge part was also dealing with the internet connection issues, or, the home where they're not, tech savvy was trying to, work through those challenges. And so what, I did was develop an actual assessment tool to send to the home before our educational sessions to kind of understand, what kind of, computer systems they have, how's your internet connection. So those were the big challenges that I find during the pandemic in delivering the course. The benefits of it was, a lot of our staff members, the staff members at the homes, were able to learn at the comfort of their homes. And so this is fantastic. It was very relaxed, setting versus being in a classroom setting. I can, talk to them one-on-one. What I did find challenging is that if you had a lot of students, you weren't able to see, the reactions to some of the questions that you're asking. But, it was fantastic that they can actually just relax and actually intake a lot of their, information that was provided for them. So, as much as I love teaching, in person to a lot of the staff members at my homes, it was also great doing this, virtual way, and where, the staff, the students was able to actually access some of the strategies at their own pace. And I thought that was a great benefit to it.
So I'm feeling that the medication course offered by Rexall, that may be the link on how we can enhance the education of our frontline worker to the training or the knowledge that they've had, just enhance that more so that they feel supported, so that they feel like they've got the right education and that it brings the tools to them that they need. The Rexall team members themselves, there's great relationship. Not only is it transactional where there is, distribution of medications or instructions or doctor's orders given, there's also a personal relationship too.
When we receive that feedback from patients or patients' families, and they say to us, you really made a difference in my mom or my dad or my sister's life. And, whether it's through being able to better manage their blood sugar or their diabetes, it's when we hear our pharmacists who have gone over and beyond or have exceeded expectations for our patients, who have gone out of their way to help and serve them.
We are so incredibly privileged, proud, humbled, and just thrilled.
I think it comes down to, feedback that we receive from our clients. I think there's no better measure of success.